So as our first speaker of this session, Megan, suggested very well, there is an increase in the number of drug-related deaths in Scotland throughout the recent period, and we also observe an increase in the mortality rates, both for those on and off OAT. For this reason, we need more recent estimates of prevalence of opioid dependence to understand whether the increase is also associated with increase in the number of opioid-dependent population or not. Thanks to the Scottish Public Health Drug Linkage Programme, we had a very large data set which included everyone who received OAT in the community in Scotland, alongside accidental opioid-related deaths and accidental non-fatal opioid-related hospital admissions. We used our Bayesian model, which is called multi-parameter estimation of prevalence model, to link this administrative data with the two types of events. Sorry, I thought I had said it. This type of events in order to estimate prevalence of opioid dependence. We started by defining a cohort with everyone who has been observed through OAT prescriptions, and we were able to split those on OAT and off OAT population. On OAT is everyone who receives OAT prescriptions, and off OAT is everyone who has recently received OAT. By recently, we mean within the last 5 years. Thanks to the unique identification numbers that each individual in Scotland has, we were able to know if an event, hospital admission or death, occurred during period on or off OAT. So we are able to actually compute the event rates, include stratification by treatment, sex, region in some cases, year, etc. So if we know the event rate among those off OAT and the number of people observed known to be opioid dependent in Scotland, either because they are currently receiving OAT or they have had received in the last 5 years, we need a link between those and the number of events that we observed, but we don't know much about them recently, so we label those as unobserved or extra population. We need a link to be able to estimate the number of people actually in the community who are not in contact with OAT services now or recently. And this is that we assume that the event rate among those not on OAT right now, but recently in contact with services, is equal to the event rate among the unobserved population. That way we can estimate the number of extra people with opioid dependence and eventually the total population with opioid dependence in Scotland. Despite the increase in the number of events and the increase in the mortality rates during the past 10 years, we don't see a massive change on the opioid-dependent population, the total number of opioid-dependent population throughout the 6-year period. There is a weak evidence that the prevalence actually might be going down, but might not. The population is aging, and we hope we can implement the same model in other locations with appropriate administrative data. Thank you.